Hello everyone, I'm Richard Caldwell, and today we're going to dive deep into something you do every single night, but might be doing completely wrong: sleeping. Let me ask you this. Do you wake up in the morning feeling like you've been hit by a truck? Your neck is stiff as a board, your lower back aches, and instead of feeling refreshed, you feel more exhausted than when you went to bed? You might think it's just age catching up with you. But what if I told you that your sleeping position could be silently damaging your heart, compressing vital nerves, and even affecting your brain function? What if the way you've been sleeping for decades is actually making you age faster with every night that passes? I know this might sound alarming, maybe even hard to believe, but today I'm sharing groundbreaking insights from Dr. Richard Caldwell, one of the nation's leading physical therapists. Dr. Caldwell is the Director of Rehabilitation at a major medical center in Boston and serves as a consultant for the National Institutes of Health. Over his 25-year career, he's treated over 15,000 patients with chronic pain, neurological issues, and sleep-related disorders. His research has revealed something shocking. Up to 73% of patients suffering from chronic neck pain, herniated discs, cardiovascular issues, and even cognitive decline share one common factor that's been overlooked for years: their sleeping position. Dr. Caldwell often tells his patients that people will spend thousands of dollars on supplements, gym memberships, and wellness programs, but they completely ignore the fact that we spend 1/3 of our lives in bed. That's nearly 30,000 hours by the time we reach 60. Sleep should be our body's golden opportunity for repair, restoration, and rejuvenation. But when our posture is wrong, those precious 8 hours transform from a healing sanctuary into a nightly session of chronic damage. Think about it this way. If you sat in a chair with terrible posture for 8 hours straight every day, you'd expect problems, right? Well, that's exactly what's happening in your bed. Except it's worse because your body is trying to perform critical repair functions while being held in these damaging positions. Now, you might wonder why sleeping position becomes so crucial as we age, especially after 50. Dr. Caldwell explains that our bodies undergo 3 essential repair processes during sleep, and all 3 are directly influenced by how we position ourselves. Understanding these processes will completely change how you think about sleep. First repair process sounds almost like science fiction, but it's absolutely real. Your brain has its own cleaning system called the glymphatic system. When you enter deep sleep, tiny channels in your brain open up, allowing cerebrospinal fluid to wash through your brain tissue like a powerful rinse cycle. This fluid flushes out metabolic waste that accumulates during your waking hours, including a particularly dangerous protein called beta amyloid. The abnormal buildup of beta amyloid is strongly linked to Alzheimer's disease and cognitive decline. Here's the fascinating part. Research from the University of Rochester has shown that sleeping on your side can increase the efficiency of this brain cleaning process by up to 60% compared to other positions. When your sleep position is wrong and you can't achieve deep, restorative sleep, your brain essentially goes all night without this crucial cleaning cycle. Imagine never taking out the trash in your house. That's what happens to your brain when poor sleep posture prevents proper waste removal. The second critical repair process involves your autonomic nervous system. During the day, your sympathetic nervous system is in control, keeping you alert and ready for action. Think of it as your body's gas pedal. At night, your parasympathetic nervous system should take over, acting like the brake pedal. It slows your heart rate, lowers your blood pressure, improves digestion, and shifts your body into repair mode. However, when your sleeping position interferes with your breathing or puts pressure on your spine and nerves, your body mistakenly thinks it's still in danger. Your sympathetic nervous system stays partially active all night, keeping your heart rate elevated and your blood pressure high. This is why some people check their blood pressure first thing in the morning and find it still dangerously elevated, even after what they thought was a full night's rest. Their body never truly shut down. The third repair process focuses on your musculoskeletal system. Throughout the day, your spine bears the weight of your entire upper body. Your intervertebral discs are constantly compressed, losing water and nutrients. Sleep time is the only opportunity for these discs to decompress, rehydrate, and restore their elasticity. A proper sleeping position maintains your spine's natural curves, allowing the surrounding muscles and ligaments to fully relax. But here's what happens with poor sleep posture. Instead of relief, you're forcing certain muscle groups and joints to work overtime in unnatural positions for 8 hours straight. It's like doing an isometric exercise all night long. Over time, muscles become chronically tight and imbalanced. Discs accelerate their degeneration, and pain becomes your constant companion. Now that you understand why sleep position matters so much, let's examine the 5 most dangerous positions that Dr. Caldwell encounters in his practice. These positions are silently sabotaging millions of people's health every single night. Starting with the 5th most dangerous position, stomach sleeping. Many people, particularly men, love sleeping on their stomachs. It feels secure and cozy, like being wrapped in a protective cocoon. But Dr. Caldwell warns that this position creates 3 serious health risks that compound over time. Risk number 1 is extreme cervical spine rotation. To breathe while lying face down, you must turn your head to one side for the entire night. This forces your neck into an extreme rotated and extended position that your cervical vertebrae simply weren't designed to handle for 8 hours at a time. The result is premature wear on the joints, inflammation, bone spur formation, and potential compression of nerve roots that travel from your neck down to your fingers. This is why stomach sleepers often wake up with numbness, tingling, or pain radiating from their shoulders down their arms. Risk number 2 involves mechanical compression of your respiratory system. When you lie on your stomach, your chest and abdomen bear the full weight of your body, restricting the movement of your diaphragm, your primary breathing muscle. This leads to shallower, more labored breathing throughout the night, creating a subtle state of oxygen deprivation that your body fights against all night long. Risk number 3 affects your jaw and facial structure. Sleeping face down places asymmetric pressure on your jaw joint and facial bones for hours on end. Over time, this can lead to temporomandibular joint dysfunction, changes in your bite, and even facial asymmetry. Dr. Caldwell treated a 64-year-old construction worker named Mike who had been a dedicated stomach sleeper for 40 years. Mike came to the clinic complaining of severe morning headaches, neck stiffness, and shooting pain down his right arm that was affecting his ability to work. After transitioning away from stomach sleeping, using a gradual positioning technique with strategically placed pillows, Mike's symptoms disappeared within 6 weeks. He later told Dr. Caldwell that he wished he'd made the change decades earlier. The 4th most dangerous position might surprise you, because many people consider it the healthiest option. Traditional back sleeping, or supine sleeping without proper support. While lying on your back can be beneficial, the unsupported version poses significant risks, especially for people over 50 or those who are overweight. The primary concern is sleep apnea. When you lie flat on your back, gravity causes your tongue, soft palate, and uvula to fall backward, narrowing your already age-compromised airway. If this airway becomes completely blocked, you stop breathing entirely. This is obstructive sleep apnea, and it's far more common and dangerous than most people realize. During these breathing cessations, which can last from 10 seconds to over a minute, your blood oxygen levels plummet. Your brain detects this life-threatening situation and jolts you partially awake to restore breathing. This cycle can repeat hundreds of times per night in severe cases, fragmenting your sleep and preventing you from reaching the deep, restorative stages your body desperately needs. Sleep apnea isn't just about snoring or feeling tired. Research shows it increases your risk of high blood pressure by 2 to 3 times, doubles your risk of stroke, and significantly elevates your chances of heart attack and irregular heart rhythms. Dr. Caldwell calls untreated sleep apnea the invisible killer because people often don't realize they have it until serious cardiovascular damage has already occurred. However, this doesn't mean you can never sleep on your back. Dr. Caldwell recommends a modified back sleeping position that can be quite beneficial. The key is placing a pillow or rolled towel under your knees. This simple modification reduces pressure on your lower back by up to 40% and helps maintain your spine's natural alignment throughout the night. The third most dangerous position is left side sleeping, but with an important caveat. Left side sleeping isn't inherently bad for everyone, but it can be problematic for two specific groups of people: those with heart conditions and those with gastroesophageal reflux disease, commonly known as GERD. For people with heart conditions, particularly congestive heart failure or an enlarged heart, sleeping on the left side can be uncomfortable or even dangerous. Your heart is positioned slightly left of center in your chest cavity. When you lie on your left side, gravity pulls your heart closer to your chest wall, which can alter the pressure dynamics within your heart chambers. For people with compromised heart function, this positional change can trigger palpitations, shortness of breath, or chest discomfort that disrupts sleep and puts additional strain on an already struggling cardiovascular system. The GERD issue is purely mechanical and affects millions of Americans. Your stomach's entrance, where your esophagus connects, is positioned slightly to the upper right of your stomach. When you sleep on your right side, this entrance sits higher than the level of your stomach acid, making it difficult for acid to flow backward into your esophagus. But when you roll onto your left side, you're essentially tipping your stomach like a pitcher, allowing acid and partially digested food to flow directly into your esophagus. This causes the characteristic burning sensation of heartburn and can lead to chronic inflammation, scarring, and even precancerous changes in your esophageal lining. Dr. Caldwell recalls treating Susan, a 58-year-old teacher who had suffered from severe nighttime heartburn for over a decade. She had tried every medication and dietary change recommended by her doctors, but nothing provided lasting relief. When Dr. Caldwell discovered she was a dedicated left-side sleeper and helped her transition to sleeping on her right side, her symptoms improved dramatically within just 2 weeks. She was eventually able to reduce her acid-blocking medication significantly. Second most dangerous position is one of the most common mistakes Dr. Caldwell sees in his practice: using a pillow that's too high. Your pillow might seem like a minor detail, but it's actually one of the most critical factors in maintaining proper spinal alignment during sleep. Many people prefer the feeling of being propped up high, or they've developed the habit of reading or watching television in bed with multiple pillows, then simply falling asleep in that elevated position. This creates a sleep posture where your head and neck are forced into excessive forward flexion, similar to the position you'd be in if you spent 8 hours looking down at your smartphone. This forward head posture creates a cascade of problems. First, the muscles at the back of your neck are stretched and held in tension all night long. Instead of relaxing and recovering during sleep, these muscles are working overtime, leading to chronic fatigue, trigger points, and eventually fibrous scar tissue formation that permanently reduces your range of motion. Second, excessive neck flexion increases pressure on your cervical intervertebral discs by up to 300% compared to neutral alignment. This accelerated wear can lead to disc degeneration, herniation, and the formation of bone spurs that may compress delicate nerve roots. Perhaps most concerning is the potential impact on blood flow to your brain. Two crucial arteries, called the vertebral arteries, travel up through small openings in your cervical vertebrae to supply blood to the posterior region of your brain. When your neck is held in excessive flexion for hours, these arteries can become compressed or stretched, potentially reducing blood flow to vital brain structures. For older adults whose blood vessels may already be narrowed by atherosclerosis, This positional compromise of blood flow represents a significant risk factor for stroke. Now, we come to the most dangerous and shocking sleeping position of all, and it's going to surprise you because it seems so natural and harmless. Sleeping with your legs completely straight, especially when lying on your back. How could this seemingly relaxed position be harmful? The answer lies in understanding a deep core muscle that most people have never heard of, but that controls the health of your lower back. This muscle is called the iliopsoas, and it's like a powerful internal cable that connects your lumbar spine to your thigh bone, running deep through your pelvic cavity. In our modern sedentary lifestyle, this muscle becomes chronically shortened and tight from hours of sitting. When you lie down with your legs straight, this shortened iliopsoas muscle acts like a taut rubber band, pulling forcefully on your lumbar spine and creating an exaggerated arch in your lower back. This forced arching, called excessive lumbar lordosis, lifts your lower back away from the mattress, creating a suspended bridge of vertebrae that concentrates enormous pressure on the small facet joints at the back of your spine. Over time, this leads to joint inflammation, arthritis, bone spur formation, and chronic lower back pain that's often worst in the morning. Dr. Caldwell explains this phenomenon using a simple analogy. Imagine trying to sleep while doing a back-bending yoga pose all night long. That's essentially what your spine endures when tight hip flexors pull it into excessive extension. This is why many people with lower back problems find that sleeping with straight legs is particularly uncomfortable, and why they often wake up needing several minutes to straighten up and start moving normally. The solution is surprisingly simple but incredibly effective. By bending your knees and hips even slightly, you immediately release the tension in the iliopsoas muscle, allowing your lower back to settle into a neutral, supported position. This single change can eliminate years of morning stiffness and back pain for many people. After explaining all these problematic positions, you're probably wondering what the ideal sleeping position actually looks like. Dr. Caldwell has developed what he calls the modified right side sleeping position, and it's the solution he recommends most frequently in his clinical practice because it addresses virtually every problem we've discussed. Let me walk you through this position step by step, because the details matter enormously. First, lie down on your right side. We prioritize the right side for the reasons I mentioned earlier. It avoids putting pressure on your heart and helps prevent gastroesophageal reflux by keeping your stomachs elevated above the acid level. Step 2 involves selecting the proper pillow height, and this is crucial. Your pillow should be just thick enough to fill the gap between your shoulder and your ear when you're lying on your side. The goal is to keep your head, neck, and spine in one straight, horizontal line. If your pillow is too thin, your head will tilt downward toward the mattress, creating side-bending stress on your neck. If it's too thick, your head will be pushed upward, creating the opposite problem. When you get this right, you should be able to draw an imaginary straight line from the top of your head down through your spine. Step 3 is to bend your knees and hips naturally to about 30 to 45 degrees, similar to a gentle fetal position. This bending is what releases the tension in that troublesome iliopsoas muscle we discussed. The moment you bend your knees, you'll likely feel your lower back settle more comfortably into the mattress as the pulling force on your lumbar spine disappears. Step 4 is perhaps the most important and is often overlooked. Place a pillow between your knees. This pillow should be thick enough to keep your pelvis in a neutral position, meaning your top leg's knee and ankle should be at the same height as your pelvis. This prevents your upper leg from rotating your pelvis and twisting your lower back during sleep. Without this support, your top leg will gradually pull your pelvis out of alignment, creating rotational stress on your lumbar spine that can cause pain and stiffness. Step 5 is optional, but helpful for many people. If you experience shoulder discomfort, you can hug a small pillow or place one in front of your chest to support your upper arm. This prevents your upper arm from pulling forward and rotating your shoulder, and upper back during sleep. This position is biomechanically superior because it maintains the natural curves of your spine while keeping your airways open and reducing pressure on your heart and digestive system. Most people who try this position report improved sleep quality within just a few nights, and significant reductions in morning pain and stiffness within 1 to 2 weeks. Of course, no one maintains exactly the same position all night long, and that's perfectly normal. If you wake up on your back, simply place a pillow under your knees and you're in the second best position. The goal isn't perfection, but rather spending the majority of your sleep time in one of these spine-friendly positions. Now, mastering the ideal sleep position will solve about 80% of your sleep-related problems. But if you want to achieve truly optimal sleep quality, Dr. Caldwell shares 3 additional secrets that can take your rest to the next level. Secret number 1 involves completely rethinking your relationship with alcohol and sleep. This might be controversial because many people are convinced that a glass of wine or a nightcap helps them sleep better. Unfortunately, this is one of the most persistent and damaging myths about sleep. While alcohol can make you feel drowsy initially and may help you fall asleep faster, it's absolutely devastating to your sleep architecture. Alcohol severely suppresses a REM sleep, particularly in the second half of the night. REM sleep is when your brain consolidates memories, processes emotions, and performs crucial cognitive maintenance. Without adequate REM sleep, you wake up feeling mentally foggy, emotionally unstable, and unable to concentrate effectively. Additionally, as your body metabolizes alcohol throughout the night, you experience what's called a rebound effect. Your nervous system becomes hyperactive, causing fragmented, shallow sleep in the early morning hours. This is why people often wake up at 3 or 4 a.m. after drinking and have trouble falling back. Dr. Caldwell's rule is simple and non-negotiable. No alcohol within 3 hours of bedtime period. If you're currently using alcohol as a sleep aid, you'll need to find healthier alternatives like chamomile tea, meditation, or reading. But your sleep quality will improve dramatically once you break this cycle. Secret number 2 is strategic water management. Frequent nighttime urination is one of the biggest destroyers of continuous restorative sleep. However, the solution isn't to drink less water overall, which would be harmful to your health. Instead, it's about timing your fluid intake strategically. Dr. Caldwell recommends front-loading your water intake during the day. Drink the majority of your daily water needs before 6 p.m., then begin tapering off. Stop all fluid intake except for necessary medications 1 hour before your intended bedtime. This gives your kidneys time to process the fluid and your bladder time to empty before you sleep. If you're currently waking up multiple times per night to urinate, this simple change can often reduce nighttime bathroom trips from 3 or 4 times to perhaps just once, dramatically improving your sleep continuity and morning energy levels. Secret number 3 involves creating what Dr. Caldwell calls a sleep sanctuary. Your bedroom environment plays a crucial role in signaling to your body that it's time for deep, restorative sleep. Your body relies on 2 primary environmental cues to activate sleep mode: a drop in core body temperature and the absence of light. For temperature, your bedroom should feel slightly cool, ideally between 68 and 72 degrees Fahrenheit. Your core body temperature naturally drops as you prepare for sleep, and a cooler environment supports this process. Many people keep their bedrooms too warm, which interferes with this natural temperature decline and makes it harder to fall asleep and stay asleep. For lighting, your bedroom should be as dark as possible. Even small amounts of light can suppress melatonin production and fragment your sleep. Invest in blackout curtains or shades to eliminate outside light sources. Remove or cover any electronic devices that emit light, including alarm clocks, phones, and tablets. The blue light from electronic screens is particularly disruptive because it strongly suppresses melatonin production. Finally, Minimize noise disruption. If you can't control noise in your environment, consider using earplugs or a white noise machine to mask disruptive sounds. Your brain remains partially alert to sounds even during sleep, so reducing noise pollution can significantly improve sleep depth and continuity. When you combine the ideal sleeping position with these 3 optimization strategies, you create the perfect conditions for truly restorative sleep. The changes might seem small, but their cumulative effect on your health, energy, and quality of life can be absolutely transformative. Let me summarize the most important points because I know this has been a lot of information to absorb. The 5 dangerous sleeping positions you should avoid are stomach sleeping, unsupported back sleeping, left side sleeping if you have heart or reflux issues, high pillow sleeping, and straight leg sleeping. The ideal sleeping position is the modified right side position with bent knees and a pillow between your legs, with the modified back position as your secondary option. And the 3 bonus optimization secrets are eliminating alcohol before bedtime, strategic water timing, and creating a cool, dark, quiet sleep environment. I want to emphasize that changing sleep habits you've maintained for decades isn't easy, and you shouldn't expect perfection immediately. When you first try the modified right side position, it might feel awkward or uncomfortable. You might even find yourself back in your old position when you wake up. This is completely normal and expected. Give yourself patience and time. Spend just 2 minutes before sleep each night, consciously positioning yourself correctly. Then allow your body to do what feels natural. Most people find that within 1 to 2 weeks, their body begins to prefer the new position because it's genuinely more comfortable and supportive. You'll know you're making progress when you start waking up feeling more refreshed and with less pain and stiffness. Science behind these recommendations isn't theoretical or based on trends. Dr. Caldwell's insights come from decades of clinical experience treating thousands of patients and from peer-reviewed research conducted at major medical institutions. The human body has specific biomechanical requirements for optimal function, and sleep position is one of the most important factors we can control. Your health isn't accidental. It's the result of countless small decisions and habits that accumulate over months and years. For too long, you may have unknowingly damaged your body simply because you weren't aware of these principles. But starting tonight, you have the knowledge and tools to transform your sleep into a powerful healing and restoration process. Change is never easy, especially when it involves disrupting habits you've maintained for most of your adult life. But consider this: if poor sleep posture has been slowly damaging your health for years or decades, then correcting it now can potentially prevent years of future pain, medical problems, and reduced quality of life. The investment you make in improving your sleep position today will pay dividends in health, energy, and vitality for the rest of your life. Remember, you spend approximately 1/3 of your life sleeping. That's roughly 25 years for the average person. Would you rather spend those 25 years in positions that damage and age your body, or in positions that heal, restore, and rejuvenate you? The choice is entirely yours, and it starts with tonight. I encourage you to take action immediately. Don't wait until tomorrow or next week. Tonight, before you go to bed, take 2 minutes to set up the modified right side sleeping position I've described. Position your pillow correctly. Place a pillow between your knees and notice how your body feels in this alignment. Pay attention to how you feel when you wake up compared to previous mornings. If this information has been valuable to you, please share it with your family and friends. Sleep problems affect nearly everyone, and most people have no idea that their sleeping position could be contributing to their health issues. You could literally help someone avoid years of pain and medical problems by sharing this knowledge. Your journey to better health and better sleep starts tonight. You now have the tools, the knowledge, and the scientific backing to make a change that could transform not just your sleep, but your entire quality of life. Sweet dreams, and here's to waking up refreshed, pain-free, and ready to embrace each new day with energy and vitality.